Hi, this month I would like to show you another bridging exercise to also help with working core stability, as well as this can also help with hip stability and even knee stability. So you want to acquire a TheraBand, a piece of exercise tubing. I'm going to be using red today, which is kind of a medium resistance. You may want to start the first month using a little less resistance than this, so perhaps a lighter color like yellow. And then red would be medium, and then usually darker colors indicate more resistance. So you tie it in a loop. You're going to place the loop around both legs and bring it just above your knees. Okay. And just as in the other bridging exercise we showed last month, you want your heels lined up with your hips, so your feet are lined up with your hips, so that you're in good alignment. You don't want your feet too wide or too close together. Then you're going to apply a little bit of pressure against the band with your legs and try to maintain steady pressure as you do the bridge. And then we're going to go back to doing those same 2 contractions to help stabilize your spine and pelvis by pulling the belly button to the spine and kind of sucking in your lower abdominal muscles. And that's one contraction. Then the second contraction is that Kegel contraction, where you're pulling up your pelvic floor muscles as if you were gently cutting off the flow of urine. And that activates those pelvic floor muscles, and they play a very important role in stabilizing the spine. So it's not just your lower abdominals that stabilize your spine, it's also the pelvic floor as well as our diaphragm muscle. It plays a role as well. So this month I'm actually going to talk about breathing with the bridge and how you want to perform your breathing. So you're going to do the belly button to the spine, do your Kegel pelvic floor contraction, keep even pressure out into that TheraBand, and then you're going to bridge up on an exhale. And slowly back down. Okay. And then reset everything. Pull your belly button to your spine, do the Kegel contraction, keep pressure on the band. Okay. And exhale. And keep the pressure on the band as you lower back down as well. Okay. And then you can do 2 or 3 sets of 10 with this exercise.